about resilience and our responses to the emotions that many of us are experiencing. And then I'm going to move on to simple, effective, and actionable tools to share. So these tools are supported by the most recent neuroscientific research, which focuses on the mind-body connection and how we can positively affect our mental well-being and our physical well-being as well. And then remember that these tools are for you, because just like when we get on an airplane, which I don't know when we're going to be doing that anytime soon, but when we do get on an airplane, we put our own mask on first. And then we'll be focusing on what you can do to support your family, your friends, and your community. I'll be doing a few little exercises in between, and we'll end with a Q&A. So, what we know. What we know about resilience, about the load you're carrying, and the responses you have to these loads. So to deal with this crisis, all of us need to employ the competency of resilience. And here are two definitions I use: the ability to exploit opportunities for growth and development offered during periods of change and uncertainty. And my favorite definition is the capacity to absorb high levels of continuous change while displaying minimal dysfunctional behavior. And I'm focusing on minimal because all of us are feeling a little dysfunctional. It's about trying to get it down to a minimal level rather than a maximum. I also want to say that resilience is about the ability to bounce back despite all the stresses and the changes that we're going through. So everything we're touching on today is to support you to build on the innate resilience that you already have. And you're getting up every day. Some of you are going to your virtual office. You're seeking ways to cope. I'm sure you're cooking fabulous meals and exercising online and Zooming with your friends and your family, and by looking for ways to get some relief. So here's a tool to help you identify and build your levels of resilience, and it's called the Resilience Continuum. And I want to just go over the conditions that deplete and exhaust us. And those are actions that are driven by force, taking away our personal choice, doing things that are against what we believe to be most important, not having the resources, and not having the support. On the other side of the continuum is what nourishes us, what gets us to a place of recovery. And those conditions are doing things that give us purpose and where we have control and autonomy of our own mind and body. And what gives us purpose also is what keeps us connected to our values and our ethics. When we have lots of resources to do it and when we are socially engaged. So it's more important than ever to try and create and expand those nourishing conditions, what feeds us, what gives us energy, so that we can stay mentally and physically healthy and be the best we can be at home and at work. So here's an exercise that I'm going to ask you to do. You're not going to do all of it right now, but it's sort of a little bit of, think of it as resilience homework. So what situations, tasks, or relationships drain your energy? So if you have a piece of paper and you put a line down the middle, what are some of the things that really deplete you? And then on the other side, what situations, tasks, or relationships really fill you up with energy and give you more juice to keep going? And I think it's really important for you to understand that we are not looking for a 50-50 split on these. The idea is if you can increase all those areas that nourish you to 85%, we can live with the 15% on the conditions that deplete us. So I'm going to ask you to just right now, take a pen or a paper, just think about what are some of the conditions that really drag you down? And what are some that completely feed you and give you nourishment and energy and juice? So an example would be practicing gratitude or doing more volunteer work. Something that's depleted is spending time with people that are really negative, or being in situations where you're always feeling like you're not good enough. So if you can think about how you can either get rid of things in your depletion list or reframe them so they're not as exhausting, that this is a really lovely tool to help you figure out how to become more resilient. So we're dealing with a lot these days, and mostly it's worry, stress, and anxiety. And I think it's important to understand that these states of being are not the same, and I want to explain them to you. So what we're dealing with is worry. That's when your mind dwells on all the negative thinking and all the things that can go wrong, and it happens in your mind. With stress, it's a physiological response to something that happens external to you. It can be acute or it can be chronic, but the most important thing to know is it happens in your body. Anxiety is the combination of the cognitive and the physiological, and it happens in what I call your mind body. And what I'm noticing in the last while, and maybe you have too, is that when you add social contagion, that thing that's going around where we are a possible source of illness to someone, or they are a possible source of transmission to us. When you combine social contagion with anxiety, we move into a panic state. And that forces us into reaction rather than reason. And just like we just talked about, reacting, always reacting, depletes us. So we want to figure out a way to not react, but to respond. As the pandemic continues without yet a treatment or a vaccine, all this worry, stress, anxiety, and panic is carried in what's called our allostatic load, the cost of chronic or extreme wear and tear on our bodies, our minds, and emotions. Now, it seems to me, based on the people that I'm working with, many of us are in something called allostatic overload, when the demand on our internal resources exceeds our capacity. COVID is really putting extreme pressure on our finite resources. We're resilient, but we're not magical. We do have a ceiling. When we're under stress, our bodies react in very powerful ways, and these are unconscious physiological responses. So let's talk about that for a sec. When we notice cues around us that aren't safe, and here are some cues that you might be noticing: people losing their jobs, businesses that you know closing, the sanctuary being empty and we're not able to sit together and pray, horrible reports from care homes. Those are the kinds of cues. Our brain starts to process them and shifts our physiological state from welcoming and comfortable to a triggered state of danger and threat. And to adapt to this, we can respond in one of three ways. So the first is we freeze. We shut down, we go numb, and like this icon, we just lock. And that can look like dissociation and depression and helplessness, a sense of hopelessness, and feeling trapped. So that's one response. The next response is the fight-flight response, or the attack, run, and hide, where we flee, we fight, and this is manifested as fear, anxiety, anger, when you just sort of lose it and you don't even understand why, frustration, panic. And the third, which I think is the most healthy that we're trying to get to quickly, is to connect, socially engage with others, or what's known as co-regulation. So this response can regulate the calming and restoring part of our autonomic nervous system. It means that we're more grounded and settled in our mind body. It means that we can stay curious and be open to what's going on around us without running or screaming or freezing in response. It means that when we're unregulated, parts of our brain shut down just to survive, and we're unable to reason. But when we can connect, when we are engaged with each other, we can start to process a lot of what's going on around us. And most importantly, we can maintain a stance of compassionate mindfulness, which is, I think, what we most need now. So I want you all to check out how powerful each and every one of you is. If you're able to calm your nervous system, which is a self-regulation technique, then those people that you are relating to will start to adapt to the tone and tenor of your nervous system and begin to calm their own. So that's really a powerful thing. So if you're with somebody who's really unregulated and very anxious, if you lower your voice and you speak softly in a melodic tone and slowly, and you have open body language and you make eye contact and you let them know that you are there for them and that you are connected and engaged, that will help them to regulate. This is called co-regulation, and it's very, very powerful. That's the physiological response that we want to get to, all of us, as our default. So what's yours? Are you a freezer? Do you flee? Do you fight? Or do you immediately go to connect? And even if you don't have that as your default, you can learn how to quickly switch from freezing, which is my immediate response. I go to freeze, and then as soon as I figure that out, I try to move to engagement and co-regulation. And it's an amazing tool. I mean, there's treatments for it, but you can learn how to do it yourself so it becomes your default. So, in the face of threat and danger, we have these three responses that I've just explained, and we also operate from three different selves that influence our behavior. And I want to share those selves with you. The first is called our overwhelmed self, which is the most defenseless, vulnerable, and childlike part of us. And you know what that's like. So I'm going to ask you to picture yourself overwhelmed, where you're feeling really, really vulnerable and like a child. Picture yourself doing something when you're overwhelmed. Hold that picture in your mind, and this is what your overwhelmed self looks like. Okay, that's self number one. Self number two is your survival self. Unfortunately, when we feel most threatened, it's our survival self that rushes in to defend us. And that's really reactive, impulsive, it can be haphazard, and often it's counterproductive. So picture yourself in survival mode. Picture yourself doing something that you survived or you're in the midst of surviving. So that's what your survival self looks like. And the third and most important is our adult self. Much as a loving parent, and there are many of you out there who are loving parents who know how to do this, what you do for a frightened child, this capable self can soothe and reassure our overwhelmed and survival selves. So picture yourself as an adult and doing something while you're in your adult role. So hold that picture. This is your adult self. And the idea here in all of this, managing our mental health and being more resilient, is to more easily access and operate from your adult self. People deal with anxiety in ways that range from harmless to harmful. And you know what I'm talking about, from binge watching Netflix to comfort eating and drinking to taking too many drugs. But the commonality is that these are ways of avoiding dealing with the pain, the anxiety, the fear, the uncertainty in this time. Here's some healthier ways. Don't avoid, acknowledge the real and the perceived dangers or threats that you feel, that you have. So acknowledging our strain will actually allow us to increase our ability to understand it and not let it be too heavy. Know what you're feeling at any given moment. So the idea is to observe your emotions rather than let them run you. This is called reflect without ruminating. Simply naming our feelings gives us more distance from them, especially when they're intensely negative. And the most common feelings that I'm hearing about from folks are fear, uncertainty, anger, despair, guilt, and grief. And I think grief deserves a few more seconds of explanation. We are all experiencing two kinds of grief right now: collective grief for what we are all feeling now, and anticipatory grief about our uncertain future. So I think it's very important that we feel them. Emotions need motion so that they can move through us like a wave that doesn't take us down, so that we don't drown in them. We just feel them and we see them move away. The other night, I actually realized my sense of huge grief of having to lose my old, or what they say in the press now, before times life. And I sat on the edge of the bed, and Eric asked me what was wrong. And I just started sobbing with grief about having to say goodbye to my old life. And it moved through me, and then it moved out. And now I feel like I'm in a better place to be able to move forward with the after times. Okay, so it's about operating from your adult self by acknowledging, naming, and feeling. So let's move on to some simple and effective tools that you can use to calm yourselves and find balance regardless of what's going on around you. And I've organized them into tools around time, space, and relationships. So the first one is schedule your worrying. If the worry gets overwhelming, put aside a time for it. This might seem counterintuitive, but actually it helps reduce the worrying. Set a daily, I would say maximum 30-minute worry period every day. You'll be more productive and calmer for all the other minutes of your day. Distinguish between the worries over which you have little or no control and those that you can influence. Like, for example, I'm not a medical person, so I actually can't control which medical staff get PPE, but I can definitely manage my own physical distancing behaviors. For me to say to anyone, stop worrying, is so ridiculous and unrealistic. People are going to worry. So ask yourself, how much time will I put into my worry budget? The next tool is set a daily wellness or sanity break. So we need to create time in our days to take care of our mental health. Please find one that works for you. Find a way. Going on social media to learn about the latest number of cases is not a sanity break. Don't do that. But taking some time to express gratitude for a family member or a friend or your community, or doing a 10-minute meditation, or praying. These are really good, very healthy breaks that will help your mental health. I work with a mother who is trying to run a business and has two small children. And twice a day, she locks herself in the bathroom and she just breathes for 15 minutes to find a way to get some relief. So that's an example. So the question is, what can you do to give yourself a break? The next one is to limit daily news consumption and avoid obsessing over endless COVID coverage, because it's activating your nervous system in very unhealthy ways. So I'm asking people to please slow down your check rate. Choose only certain credible channels and websites. And I suggest 2 30-minute chunks twice a day, like one in the morning and one later in the day if you're going to check the news. But please don't do this before bed because you'll get nightmares. The idea is to stay informed, not overwhelmed. And if you already are someone who has a tendency to consult Dr. Google for every itch and sneeze, you may be over-researching the pandemic as well. So ask yourself, when and where will you get your news? So schedule worrying, set daily sanity breaks, limit news consumption, don't obsess, and try and maintain some semblance of structure from your pre-COVID days. As you work from home, or if you're feeling stuck at home, it can be really tempting to fall into a more lethargic lifestyle, which could lead to negative thinking, to ruminating, and even to depression. So wake up and go to bed around the same time that you used to. eat meals, shower at the same time, adapt your exercise regimen, and could you please every now and then get out of your pajamas or your sweatpants if you find yourself wearing them all the time. Not only will sticking to your normal routine keep you active and less likely to spiral downwards in terms of your mental health, it will be easier to readjust to the outside world as we move from phase to phase of the reopening. I know for me, I get up, I exercise, I take a shower, I get dressed, I put on makeup, I put on jewelry, because I want to normalize my life. And in the beginning, it was really hard for me to do. So that's how I'm trying to stay as close to my normal routine as possible. Okay, so there's tools for your space. Use your breath. People are holding their breath, waiting for this crisis to be over, and you can't hold your breath for much longer. Breathing is healing, and it's an amazingly easy and effective way to calm your mind and body in the present moment. In fact, there are certain breathing techniques that can actually clear your bloodstream of cortisol. And sometimes cortisol is a good thing, but sometimes it can be a very insidious and destructive stress hormone. And it can do these breathing techniques in as little as 1 minute. So one of them is called 4x4 or box breathing, and the other is 3 in, 6 out breathing. And I thought it would be fun if we could do it together. So we're going to try it, a little activity. So the 4x4 breathing or box breathing is we're going to inhale for 4, hold for 4, exhale for 4, and hold for 4. So let's try. In, 2, 3, hold. Out. Hold. Do it again. In. Hold. Out. Hold. Let's do it one more time. In. Hold. Out. Hold. You can do that anywhere, anytime, and it will help you self-regulate. The next breathing technique is called 3 in, 6 out. So we're going to, through our nose, inhale for 3, and then really push the exhale for 6 as we blow out through our mouth. So inhale through our nose for 3. Exhale for 6. Let's do it again. Okay, one more time. Come, let's do it. In. Out. This is really helpful as you exhale to self-regulate and sort of calm down your nervous system. Okay, so that's breathing. Next is to move. Exercise is a classic anxiety reduction strategy. A burst of jumping jacks or running up and down the stairs or high knees, whatever you can do in a rapid, reliable way is great to discharge stress and quiet not just the body, but the mind. Another tool that we are so lucky to live here, that's because it's so accessible, is to connect with nature, to go outside and find some kind of open space safely and be in the earth's rhythms to help self-regulate. This will allow you to expand rather than contract. I'm working with so many people who are so physically and emotionally and mentally contracted and just like frozen in time. And when you're outside, you can expand your body and your mind. It's a very healing, helpful technique. Another is to practice mindfulness, to create the space to be in your body, to quiet your mind during this time rather than to be doing and to the point of distraction. I like to think of it as a holiday from your negative and anxious thinking. And you can do that by self-soothing. This is your adult self, remember, soothing your overwhelmed or survival self through actions like rocking or humming or singing or just holding onto your heart. You can practice self-talk by putting your feelings into words. This is a process called affect labeling, and it really can diminish your freeze, flight, fight responses. You can say things to yourself like, it makes sense that you would have this feeling. This is your adult self saying to your overwhelmed, or these feelings won't last forever, or it's okay, I'm going to protect you. This is actually the practice of self-compassion, because when you take steps to manage your own mental health and reduce your suffering, you'll be more motivated to help other people do the same. And then you can meditate and you can pray. So all the research says that 5 minutes a day of mindfulness can help regulate your nervous system, improve your mental health and acuity, and increase your resilience. And you can create rituals. I call them quarantine rituals, which add meaning and intentionality to my day. And so I want to share with the extra time that I have, extra time that all of us have, because we're going less places and we're commuting less, we can do something to help us look forward to every day, like taking a walk in the morning or writing in our journal or speaking to a family member on FaceTime. So here are 4 daily quarantine questions that have been really helpful for me that I want to share with you. The first is, what am I grateful for? Who am I checking in on or with in order for me to stay connected, right? What expectations of normal am I letting go of? And what beauty or joy am I inviting into my life? I think it's very important that we try to create or cultivate or just invite something into our lives every day that will give us joy. I mean, I like to cook. So every day I wake up and think about, okay, what fabulous meal am I going to cook this evening that's going to bring me joy and my beloved joy? So those are tools for your space: breathing, moving, getting outside and connecting with nature, being mindful, and having some very healthy quarantine rituals. And in terms of relationships, it's all about boundaries. We can lose our ability in the fear and anxiety to know what belongs to us and what doesn't. And we really need to create and respect our personal and professional boundaries, know where they begin and know where they end. So I'll give you some examples of what I'm talking about. And I've heard this quite a bit from different people I'm working with. So taking on someone else's financial stress as our own, even if we don't have the same financial circumstances, and then feeling guilty about it as if we are somehow at fault. So that's not good for us. Another is allowing a colleague, a client, or a family member or a friend treat us with disrespect over and over again because they themselves are unable to manage all the emotions that they're feeling, their fear and their anxiety. Listen, extending the benefit of the doubt initially is kind and it's right. But accepting ongoing mistreatment is not. We really need a boundary to protect us and to take care of us. And finally, because so many people are working from home, we need to manage our temporal boundaries too, because work time and non-work time are all happening in our house. So we've got to leave work at the door, even if you can't leave the house. I'm going to ask you to think about to name 2 personal boundaries and even 3 professional boundaries that you can set up for yourself or that you've already set up for yourself. So I'll give you some examples. When you're done work, you close the computer, you stick it in a drawer, and all your calls go to voicemail. That's a really clear boundary between when you're working and when you're not. My husband taught me the greatest boundary setting exercise in the world. You walk in the door, or you leave your office in your home, you take a shower and you wash everybody and everything away so that when you walk out of the shower, you're ready to start your personal time. Those are some examples. In terms of, personal boundaries, I feel it's really important to practice discernment and avoid negative thinking and negative people if that's possible. So that's a tool. And then there's practicing social distancing. This is about lifting your empathy quotient and your compassion quotient by firstly being kind and polite and courteous to everyone, and then taking it further by doing small, medium, even large acts of generosity. This is the social engagement response to the threat of COVID-19 that I was talking about. So there's been an explosion in brain research around this. Empathy is feeling with someone. It's the resonance of emotion between you and the other. However, it can actually generate the pain centers in your central nervous system. Compassion takes it a step further and is connecting with that suffering and shifting to the most important question, which is, how can I help? This can open the pleasure or dopamine centers in your brain and nervous systems for real. You don't even have to know what the answer is, but just asking that question, how can I help, will start to self-regulate and then co-regulate with the person that you're trying to do a good service for. This is it. Doing for others can increase your cognitive health and be empowering for you and for others. So try to get out of the helpless, hopeless zone. I don't want to be Pollyanna about this. I know that there are some days where you're just not going to be okay. It's okay to not be okay all the time. But if you feel like you're moving into that really helpless, hopeless zone, it's really a good idea to dig into acts of kindness rather than digging into your own suffering. And it doesn't have to be a huge effort. You can pick groceries up for people if you're already going for groceries for people who can't. You can call a family member or a friend who's on their own. You can send a text to someone. So what is true is that loneliness is really bad for humans. Social isolation generates at least as much escalation of mental illness as the fear of getting illness from COVID itself. So I'm reframing social distancing into physical distancing or pro-social distancing, and I'm practicing that instead. So call your parents, call your kids, call your friends every day. Choose to connect. It's a really healthy thing to do. And finally, seek help. Find a professional if you want to help you manage your anxiety. Some people need an external objective third party. There are a lot of therapists who are doing sessions online, and you got to find someone with the right fit, but check it out. There's nothing wrong. In fact, it's a very courageous move to go seek professional help. Okay, so tools to support your community by communicating in terms of how you communicate with family and friends and all the people, employees, customers. You're not alone. So how can you best support each other in your communication? And there are 4 tools that I really want to share with you because I'm noticing this more and more. Please remember that when you're under stress, people's fearful and anxious mental states can often get in the way of their comprehension. It doesn't mean they're stupid. It just means that your messages have to get through the barrier of fear and uncertainty and worry and any other distraction that exists in their mind body. So please always begin with a human connection, not any kind of technical information. Give recognition and possible reassurances whenever you can. It's so important to start every interaction with a quick way to increase affinity and psychological safety in the room, even if it's a screen, even if it's in a virtual room. The next is to offer more frequent and shorter updates. So it's more, not less. In the absence of regular and ongoing communication in real life that we have with each other, because some of our bubbles have our immediate family, and we aren't even able to go outside of that. So we're not having a lot of in real life situations. So we can make a lot of assumptions when we're not actually with somebody, and that can sometimes force us to create these worst case scenarios when we're not in close communication. So this increases the already heightened arousal states that we're in. And I'm really not talking about the fun kind of arousal, which then decreases people's ability to understand what we're saying to them. And this can lead to mistakes and miscommunication and trouble. So I'm actually saying to some clients, replace long words with shorter ones, because our cognitive ability is being impacted by our stress and our anxiety. Ensure consistent messaging and tone, right? So when delivering your message, you are paying attention to three things when someone's talking to you: their words, their body language, and their voice tone. Three things. And you know what? Of the 100% that you're paying attention to, 7% is the words. So in person, we use all our senses, but when we're on video, we only rely on sight and sound, and we're not even actually able, we can't have the sense of touch. Research shows that when it comes to communication, touch is such a powerful sense. There was one study that was done that discovered that shaking hands led to more open and honest conversations, and that means better outcomes. So when we can actually touch someone, it increases the release of oxytocin, or the cuddle hormone, and that builds trust among people. So we don't have that a lot of the time. So we have to really be sure that when we're talking to someone, our messages, our body language, our voice tone are consistent. And then finally, so many of us are, so zoomed out. And that's because it's really hard. We're exhausted from it. It can actually lead to feelings of more isolation, disconnection, and anxiety, because all the artifacts of digital imaging, like the blocking or the freezing, the blurring, sometimes we're looking at someone and they're speaking out of sync. These can be really disturbing, and it makes it harder to focus and concentrate. So I'm saying to folks, sometimes it's just better, very old fashioned, but to pick up the phone and just focus on one sense. So when you're in communication with people that you are hanging out with, your friends, your family, your staff, if you're working, colleagues, please remember that when we're communicating in this time, everything is really heightened and people are very sensitive. So we really need to pay attention to how we're doing that. So those are other tools to support you in your community. So I understand that I'm not going to be able to see you, but I thought now would be a good time to chat. So if there's any questions, I'm more than happy to answer them.
Thank you, Deena. I thought maybe I can help facilitate those questions a little bit.
That would be great. So I'm up for questions. And also, I just wanted to say that I prepared a PDF of all the tools in sort of one PDF document, in case you want to remember them or you want to share them with your loved ones or your colleagues, and you might love your colleagues too, so that you have sort of a tip sheet. And I'm going to send it to the synagogue, to Temple, Kathy, I think, and then she can send it out to people who are interested in having that information.
Right. Yeah, we have everybody's email address because they registered for this, so we can send that along to them. So there's two questions right now in the chat queue, and I'll just bring everybody's attention to the bottom of your Zoom screen. There's a Q&A button down there, and if you click on that, you can add your own question. And if you do that, we will answer it. So the two questions that are here, other than a hello from Sherry, and you don't have to put your name on these, by the way. The first one is, how do you deal with people who aren't as vigilant about social distancing as you are?
Humor is a really good way to do that. I've been in that position. Um, Eric and I went to Victoria to spend time with my folks last weekend, and we had like the big talk with them about, okay, listen, we can't hug. We have to really be, we're going to be in the same place, but we have to have enough distance between us. But it's hard. It's such a weird thing to do, especially with your family. So there were lots of times where my father was getting a little too close. I was like, Daddy, move away, just keep your distance. And we would laugh about it, and and everybody would sort of get back to taking care. It's just so antithetical that we love people and we want to be close to them, and in loving them we have to be far away. So I think humor is really important. And the other thing is, we have personal agency, so we can move ourselves and remind people that we're doing this because we care about them.
Very nice. Thank you. Actually, the other two were really more highs to you again. So that was the only question in our queue. I want to encourage people to add their questions in if they would like. But let me offer one as well, because I've discovered this for myself. We've just started to do some in-person gatherings with the synagogue, very small groups out in the park and stuff like that. And it's a little weird re-entering the world. You know, it's been 3-4 months since I've seen, or any of us have really, seen other people other than, stepping aside from them on the sidewalk and that kind of thing and re-engaging. It was a bit stressful to sort of encounter people again. Any advice on how to re-enter society?
Yeah. Well, I think it's important to be mindful of how weird it is,
Mm-hmm.
and to be able to actually name it and say, this is so weird that we're here together. And I want to talk about how happy I am to see all of you.
Oh, yeah.
I mean, there's an exercise that I do with teams to connect when they haven't seen each other for a while. And it's like, okay, everybody share a sweet and share a sour.
Mm-hmm. Nice.
Give me a highlight and give me a low light for you really quickly as we just go around, because we haven't all been in the same place for the last 3 or 4 months. And sort of naming that emotion and watching it sort of, that weirdness, and then watching it move through you like a wave will allow everybody to name it for themselves. And Dan, you're a leader. And so when you can say that first, everybody else can relax, because I guarantee you, if you're feeling that, we all are too.
Okay. So it's nice to be normal, right? It's good to be normative. So another question that came in the queue is, what advice do you give to people who live on their own as they might be feeling more acutely socially distant?
This is a very important question. So we know that social isolation is very bad for our mental health. And that means that it is incumbent upon us to figure out how we can stay as connected as possible to the people that matter to us. And if that means being more on Zoom, then you have to do it. If that means that you take the time to reach out. I also want to say that it's important for us to be able to ask for help. And if for those of you who know people who are on their own, I want to beseech you to reach out to those people more often than you are, and let them know that you're there, because it is really devastating. And also people who don't have the ability, who are social and can't get out, even if they live with somebody, right? I mean, it's been really hard for me. I'm very extroverted. I live with someone who's so happy to actually never go out if he doesn't have to. All he really wants to do is hang out with me, which is great, totally great, but it's not enough for me. So I've had to work really hard to figure out ways to connect. I spend a lot more time on the phone. Like, I'm sort of like a teenager now. I'm always calling my girlfriends and finding out how they are. It's really important. So I think we have to be patient with each other and be way more kind and way more mindful, especially for people who are feeling isolated and on their own. It's not good for our mental health.
Yeah, yeah. There's two more questions in our queue. This next one actually kind of, I think, builds on what you were just talking about. Some of my loved ones aren't being as safe as I would like, and I don't want to be judgmental and argue, so how do I deal with it myself?
What a great question. Let the two of us be one and let that one be me. Um, we're 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 only in charge of ourselves, right? I think the way we can do it is to express in a very kind and loving and sincere way that we're worried about. I'm worried about you because I've noticed that you might not be as socially, as physically distant as you need to be. And I just want you to know that I want you to be well and healthy. And so I would love it if you would consider being a bit more careful. And then you have to let it go.
Yeah.
But I think you shouldn't hold back. I think that you can express your concern without, telling somebody what to do, but inviting them to consider their safety and the safety of others.
Yeah. Yeah. So another question here, and this came in from an anonymous attendee, but I could attach my name to it, or anybody probably could. I have a lot on my plate these days, and am feeling really depleted. I have a hard time giving myself permission to take a day off, even though I know self-care is important. What are your thoughts?
Well, you have a lot of company. So what are my thoughts? I think that you deserve it. And I think that this is a marathon, not a sprint. And what I've noticed in my clients is this huge adrenaline rush of activity and action in, for sure, the first month. But the body has a ceiling of energy and can only manage so much. And what people are starting to exhibit now after 3 months are signs of burnout because they are not taking time off. And unless it's life and or death, nobody is going to worry if you have to take an afternoon off. Find somebody to take your place. I know that everyone thinks that they're indispensable. You're not. You can find somebody to do something on your behalf so that you can take care of yourself. And you're not just taking care of yourself when you take time off. You're taking care of your family, you're taking care of your employees, you're taking care of your community. We don't have infinite resources. And I am really hard on people who are not taking holidays. Like with my clients, we're coming up into summer and everyone's just so adrenaline rushed and then getting really resentful and frustrated and burnt out. And I say, there's only one answer, and that is a vacation. And even if the vacation is a long weekend, that time away from the computer, just to be mindfully relaxed and to be rather than do. It's a really good way to manage your mental health and build that resilience.
Lovely. Thank you. It's so important. So there was a follow-up to that previous question, just a clarification, I guess. The question before was really about how do I, as an individual, deal with those that are not being judgmental? How do I, as an individual, deal with those that are not being as safe as they could? How do I deal with that myself? Like, how do I deal with my own judgmental feelings? How do I let go of my own worry for their health?
Right. Well, that's about creating healthy personal boundaries. So for me, I mean, I create this boundary. I'm a therapist at sometimes in my life, and for many years, and I've had to protect myself from all the pain and the suffering and the worry that's coming at me from other people. And so what I've done is I've created this. You can't see it, but I know it's there. It's this invisible rubber breathable covering that goes from the top of my head underneath that covers my entire body. So people, my concern and people's stuff comes at me, but at a certain point it has to bounce off or else they're going to take me down. So those judgments that you're feeling are going to take you down. So how do you protect yourself from those judgments? Because you can't go down. You have to be well in yourself. How do you say hello to the judgment, but don't let it get so close to you that it harms you and affects your own mental well-being?
Right. I mean, I know that when I was doing pastoral work in hospitals, chaplaincy work, they would often talk about not becoming the wounded healer. You know that if you take on everybody else, because you're seeing it all the time, and certainly in this environment, we have so much to worry about. But everybody's got to worry about their own stuff too, and you can't take on other people's worries. I mean, I know that that feels like a Jewish thing, but it really isn't.
Well, I
Uh,
think it's a wonderful thing to be a Jewish warrior, but there's a line. You've got to figure out where your line is.
right,
And we don't want to suffer from what's also called in the pastoral counseling world compassion fatigue.
right, right, for sure. Yeah. You've answered all of the questions that are in our queue, and I don't know if you still had a little more to your presentation, or have we covered your whole thing?
Well, I have one more slide,
Okay, good.
which is resources. So what I've done is there's so much out there, and I don't want people to have to do it for themselves, because you can get lost. Sorry, you can get lost in it. So in the PDF that I put together, I've listed all these resources that have been really helpful for me, different meditation apps and different um, theories of managing anxiety and calming oneself. And I thought that I would share them with the group, and then you can add them to what you're already doing. But these have been proven to be really helpful and easy and accessible.
Wonderful. Oh, those are terrific. So
Okay,
we'll make sure to send those out with our with the materials that you're providing us as well.
thank
Thank you,
you.
Deena. Thank you.
And it's 1:56, so we're in on time.
You're perfect. You're right on time. Thank you so much. Let me bring up my screen again. I'm going to ask you to stop sharing your screen if you can.
Okay, stop share. Here we go.
Perfect. Deena, thank you. This was terrific and so necessary. And we were even getting a few chat comments along the way of people that just kind of happened upon this on our Facebook or our YouTube page, and just it was just what they needed today on a well, it's rainy here. They could have been from anywhere. I don't know. But on a Friday afternoon, as we prepare for Shabbos, to do that cheshbon hanefesh, to do that sort of soul check in with ourselves, and be ready, prepare ourselves by being able to rest and to de-stress. So thank you so much for that.
Oh,
Thank you.
Shabbat Shalom. It is such an honor to be able to offer some kind of ways for people to give themselves some relief and some self-care.
Well, we're honored to have you as part of our congregation and our community. You've helped a lot of people today, so thank you.
Thank you.
I just want to draw everyone's attention to a few things, if I can, online before we close. A reminder that there are services tonight at 7 o'clock. That's at the park. If it rains, well, it stopped raining now. If it looks like it's not going to clear up enough, we'll send an email to all those who have registered by 5 o'clock today to let you know that they're canceled. We'll send an email to let you know they're going forward to around 5 o'clock. And if they are canceled, we'll continue to stream them at 7 o'clock, but they'll be from our homes instead of the park. Havdalah tomorrow night at 7:30. Services tomorrow morning at 10 a.m. A reminder that the annual general meeting is taking place on Tuesday at 7 o'clock for those members of Temple Shalom. And then lastly, I just wanted to bring your attention, here's Deena's wonderful picture, that on Thursday next week, June 18th, we'll be having our next in our series of Let's Talk About It with Dr. Tiro Shapira, who is an Israeli researcher working out of UBC, who is working, one of the few researchers in Canada working on a COVID-19 vaccine. So it should be a really fascinating conversation, and I hope you'll join us for that. You can sign up online. That's at 4 o'clock next Thursday. Again, we want to thank Deena for your time today. I want to thank the Temple Shalom Caring Community Fund that makes these things possible. Deena volunteered her time to us, and we thank you for that. But the technology to do this and all those things, we've had to acquire that for our synagogue. I think we're putting it all to good use. And the Caring Community Fund is part of what makes that possible. So thank you those who've supported the shul in that way. Have a wonderful rest of your pre-Shabbos, and have a Shabbat Shalom. Thank you, Deena. Thank you, everyone, for joining us. Bye.
Shabbat Shalom. Bye.
Shabbat Shalom.